I did send the commission out what I briefed to Area Command this morning. And then I also received some questions from Commissioner Schutte. So a lot of the data that we sent out, I pulled that from, I think, 5 different sources. So you have a snapshot from a lot of different places, everything from the New York Times to our own local statistics. And all those show us on a very nearly vertical climb on COVID cases. We've had more deaths than we've had in the past. We have more hospitalization. And I'm going to jump right into Commissioner Schutte's questions. And then Dr. Gushee, you can help me out with this if you would. So one of his first questions was, what is Mason's Health's bed capacity? And what I was pulling off of WATRAC. Now, keep in mind, WATRAC is the thing that we use to track beds throughout the whole region. And what I was showing this morning was there was 1 ICU bed, but no negative pressure beds available there. So I guess I would ask Dr. Gushee, what does this mean for people having heart attacks, strokes, et cetera?
Yeah, it's a huge crisis, not just for us, but everywhere in the state for sure. We were reviewing that this morning. We are now doubling up COVID patients in bed in rooms that were not designed to be shared, but looking at taping curtains up and things of that nature. So it's an enormous crisis. Last I heard, we had 10 COVID positive patients in the hospital. That's a record for us. We're likely canceling surgeries. We're looking at that today. I'm certain that we'll be canceling surgeries, so we'll be putting off care for patients who have other conditions. Last night there were no beds available for transfer of patients in the region. So we're boarding patients more and more in the emergency department. We're looking at whether or not we need to convert other spaces that are not patient care spaces. For example, even conference rooms. We're having conversations about, do we need to convert a conference room into some sort of low acuity care space because we don't have oxygen in those rooms, we don't have monitors in those rooms. And more to the point, we don't have nurses. So, we are at the point, we're bursting at the seams. The place is absolutely full. We're not different than the rest of the state in that regard. And, I get on these state calls and it's more like it's like a mutual support group. Nobody's got any ideas because there's nowhere for people to go.
Yeah, I double checked that with WATRAC this morning, and I'm tracking 0 beds at St. Pete's, 0 beds at Capitol, 0 beds in Kitsap.
Yep.
So it's just that way. We're all across the region. The places we normally cross level to have no place to cross level.
Absolutely.
They're looking for places to send folks. So Commissioner Schutte's next question is, what is the region's hospital capacity? Right now, none. I mean, we are at capacity. And in fact, we're talking about at state level, crisis standards of care as a possibility, but that is something that has to come out across the whole state, not just regional. So DOH and I think the Secretary are reluctant to do that, but it's probably on the table. I'm certain it's on the table at this point because everybody's having the same problem. Let's see. So this kind of a point where we can take a break on that. Are there any questions on that piece?
None for me.
Okay. So what is public health's plan to reach vaccine resistant people? And what is Mason Health's and PCH's role? So right now, Mason Health and PCHS are 2 primary providers, but we also have all the pharmacies as well. So the pharmacies do have the capability. And then as of this morning, I see that Pfizer is has been approved for general use. So they got the full FDA approval as of this morning. So that may change some of who is vaccine resistant. I know there were people who were waiting for that moment when it becomes an approved vaccine and then they'll get it. So we might see an uptick there.
Is there an age, a set age limit on that?
I think it's still the 12 and up.
Yeah. I know they're looking, they're studying the 2 and up, I believe is being studied. Dave, I don't know, Moderna, I think is being looked at, and Pfizer both have studies at 2 and maybe even younger than that on up. So I wouldn't be surprised if we saw emergency authorization come out for those sometime soon.
Right. In fact, we've had conversations with Eric Mole and with Jennifer up at PCHS. And then Mason Health staff has been on the calls about pediatric. What are we going to do when we have that open up? So we're not going to be doing a drive-up clinic for that. That's just not a way we're going to go. Which leads into the next question, planning to restart public health run vaccine clinics. And that's really kind of a question of demand. At this point, we're not seeing the demand that would look at doing the large setups like we had this spring, where we're doing 700 a day, 1,000 a day. But as we get into the fall, and we have, they're calling it a booster, but it's really not a booster, it's a third dose. And that will be authorized for general use for those 8 months prior, they were vaccinated 8 months prior. In September 20th, I think, is what we're seeing for the CDC's standing order signature thing. There's already guidance out right now for those who are immunocompromised or cancer or for whatever, who can get the third dose. So we may see some increase if we have the FDA approval and we have the I'll just call it boosters available. We might see increased demand. In that case, we can put together a clinic. We have the trailer right here, and it doesn't take that long to put a clinic together. And again, it comes back to staffing.
The other thing that's going to increase demand, I think, is the governor's mandates. Of course, we're struggling with that right now around healthcare and the mandate to get vaccinated. It's a very heavy hand. We're definitely going to comply with that. We will lose staff over it, mostly to retirements, because people, if they want to work in healthcare, they have nowhere to go because pretty much everybody is mandated the same, and many other states around us are also mandating it. So we're struggling with how we're going to address that, but I think that will increase some demand on the teacher side, on the education side, because it's similar demand or similar mandate there. And on Mason Health side, I don't know if there's any public or private industry out there that's doing the same, but I think the dominoes are beginning to fall.
I think so. One of my concerns has been not necessarily the doctors and nurses, because I mean, really, where are they going to go? And that's kind of been the governor's point. My concern is the infrastructure staff, the janitorial staff, the nutrition staff, all those other folks, could leave the system because they can go work someplace else. So I'm concerned about that. And I'm concerned about that as well with our emergency response folks, especially the volunteers. It's tough to fire a volunteer. So I've asked for letters from the different agencies to tell me, what is your best guess of what this looks like? And then I can take that information and run that up to through the health officer channels to talk about it at the state level. So I'm just really concerned about that infrastructure piece.
When you're already at critical mass, you can't afford the little bit to lose. That's the thing that's amazing to me. My wife is in the field in Kitsap, and they closed down the urgent care in Bremerton. Then ambulances are lining up because they don't have enough people to take care of them as they're coming in the driveways in the Silverdale one. How do you do it without one less, let alone 20 less? I don't know, Dr. Gushee.
Yeah, it's an issue. We have been discussing mandates for months, and nobody in healthcare, nobody at any other organization was willing to pull the trigger because of exactly that. So our nurses, that are adamant about not getting vaccinated would leave and go somewhere else. But the governor essentially shut that down. I think it's the right move, to be honest with you. Our last 30%, we work in healthcare. It's not okay for people to work in healthcare and endanger their fellow staff and their patients and their families, for that matter. And so I think it's the right decision, but it's certainly going to be disruptive. A lot to work out there.
Dr. Gushee, just if I could just maybe jump in on that one point. Correct me if I'm wrong. There are other immunization requirements to work in healthcare currently, correct?
That's true. Yeah. So this one, obviously, in the emergency use authorization, none of the other ones are emergency use authorization. And I think there's a reasonable argument to say, I'm going to wait until it's fully approved. I can buy that one. But now that Pfizer is fully approved, it's been used in hundreds of millions of doses. There's not an excuse any longer. And so now it only takes on really what amounts to a political color to it. This is not based on science or anything else at this point. So you're right. There are other vaccines that nobody bats an eye at that they get to work in healthcare, but this one, for some reason, is different.
Thank you.
The next
question a little bit on the topic, but off. You've talked about shared rooms. Is it possible to get two different variants at the same time?
I do believe it's been reported that people have had, if you test people's antibodies, you do find people that have had both, either concurrently or have had the variety, different variants at the same time. Yeah, it's not ideal. We would, in an ideal world, we don't want to be sharing rooms.
Oh, I know you don't.
But we don't have any choice. We're also looking at putting in more reverse airflow rooms, trying to set those up. But, we are at a point where we really don't have any choice. So yeah, it's a valid point you make, though.
Dr. Gushee, how much time does it take to, because I know that changing the PPE, you go from one room to the next, but you have to change before you go into the next.
Correct.
What's the average time?
I don't know. I don't know that we've actually studied that, but I'll tell you, they're getting awfully good at it. So that has, the ability to move from room to room has not really been an issue for our people, other than the annoyance factor of having to do it. But they're getting awfully good at doing it, and it's become sort of standard practice. So,
Thank you.
Another question was, where can people find information on how or where to get tested and vaccinated? So if you go to the county website, just click the red COVID button. It takes you to our page. You can also go to the PCHS page or the Mason Health page. And that's the first thing on all of our pages is the COVID piece. We do have at Mason Health, we have a testing hub, a kiosk set up over there. So people can use that one there. We also have one at the hub up north in Belfair. So we have the testing capacity out there. Our positivity rate is at 8%. And when I called DOH about that, because it jumped from 1% to 8%, part of the issue is the backlog in reporting the negative tests, not necessarily because the positive tests are getting reported right away, but there's a backlog of about 155,000 negative tests over this last week that haven't hit the system yet. So that will probably bring our positivity rate down. So we've got the testing capability out there. It's just how it's reported looks a little wonky right now.
I really appreciate what Mason Health is doing on social media as far as talking about some of the myths out there surrounding the vaccines and really just taking the time to answer some of those questions. And I know our All Hazards Facebook page has been sharing some of those those posts as well. I think it's really important that people, I mean, we've seen over the past week people taking medicines even prophylactically to that are intended for or FDA approved for certain uses, but generally approved or intended for livestock and self-prescribing and dosing and medicating and things like that. And it's just so critical to cut through a lot of those that misinformation that's out there. And if you're willing to go that route for treatment and prevention, really encourage you to talk to a healthcare provider and ask these questions and get answers versus just taking the word of it of online social media posts.
I appreciate that. Certainly we're doing a lot of work. It is an amazing thing. I've had conversations with smokers who tell me they don't want to take any of those chemicals into their bodies, and then you're sucking in a cancer-causing agent without any concern. It's a funny thing how people think, but it is important to keep telling the true story and making certain that we're providing the best information.
One thing I'd really like to bring up, and this is really important, I think, is that, and I sent it out in the packet this morning, if you look at the graph of who is in the hospital versus who is vaccinated, it's 94.6% of the people in the hospital or who are dying are unvaccinated. So, and if you look at the graph, you can see that I don't have it ready to share. I will put it out though. The green line at the bottom is the people who are vaccinated, and it's a very low rate of increase. If you look at the folks in red, very high increase, very sharp increase. So there's a very broad difference between.
Do you have that number for how many are positive that are vaccinated versus non?
Yeah, 94.6%.
You said that was hospital.
Well, so it's about 95% of people going into the hospital are unvaccinated.
Yeah, but what I'm asking is the ones that are coming up just positive versus negative.
Yeah, and it's the same number. So in the graph that you had, you saw the tests, the cases hospitalized and deaths, those three things, and it's all in the 95% range.
And that's what I had seen also before. It's funny because we're talking about misinformation. I want to make it clear, I am never a fan of forcing anybody to do anything. I'm just not. But at the same time, it's important to have accurate information out there. And when you see the memes out there where they're saying that, if it doesn't work, if you can still get people sick, if you can still, it's pretty obvious. If you have 95% are unvaccinated and 5% are vaccinated, it's got to be working, period. You can't have anything go skew that far on a placebo. It's just not even possible. So therefore it is having an effect. And if you're going to make your decision out there, base it on that and the reality of what's really happening. You can have your emotional attachment. You can decide, no, I'm not pushing anybody to do anything different, but at least realize it is working. It's obvious by the numbers, and you can't even prove in any way the opposite.
Yeah.
And I think at today's EOC meeting, our last one, we talked about changing the messaging. I think if Mason County also changes its message, it's not just COVID that's killing people. We also have heart disease, we have cancer, we have diabetes, we have obesity. There's so many different things out there that are hurting people, that are killing people, that are making them sick. So if we talk about health as a whole, I think COVID has been politicized, and unfortunately, and from day one, it was politicized. And so for us to start changing our message to health, total health, not just COVID, it's going to help people. It's going to make them understand that we all need to be healthy. Or gosh, I've got what I call breadsticks on my back and belly that I need to work off because I need to, because that's my health and I'm responsible for my health. That's what the message should be. Be responsible for your health. I don't want to force anybody to do something that they shouldn't or that they don't want to. My brother, and I'm sure I've told this story before. My brother had COVID. He also has heart issues. So there's no way he could get the vaccine. But he's doing other things, other ways, or he's implementing other things into his life to make sure that he stays healthy. We all need to do that. We all need to take responsibility for our own health.
You bring up an interesting point, and I looked at the CDC, what are the contraindications to the vaccine? And there's a lot of misunderstanding there. Specifically, the only real contraindication of the vaccine is if you've had an allergy to it. Everything, there really is no other downside. So you describe heart disease, absolutely the right person to get the vaccine, because those are the people at risk that if they get sick, they're more likely to die. So there's very, very few contraindications to the vaccine at all. And I've heard providers tell me the same thing. I recommended against vaccination for a patient of mine who had severe asthma. Well, that's exactly the person who should get it. The vaccine doesn't worsen any of those chronic diseases. It protects against the complications related to the disease itself. So there's as we start looking at the mandate and who we're going to be able to opt out of from a medical point of view in our organization, there's darn few, because there are very, very few reasons why someone should not get vaccinated. And it's basically an allergy to the vaccine or its components.
Yeah. And then you have the people that have the antibodies because they caught COVID.
But those people still should get vaccinated. Having had the disease is not an indication. The CDC still recommends it, because the problem is nobody knows what is a protective level of antibodies. That hasn't been established. That science isn't done. And so although you can measure the fact that they've had it, it doesn't imply that they're protected in any way.
And again, I'm not trying to, talk people into doing anything they don't want to do, but I do want to make it clear that all the issues we had in the beginning of the rollout and how it was not available, that's not an issue anymore. If you decide you want to do it, if it becomes your choice that you are in support of doing that to your body and getting that vaccination, it is everywhere now. Matter of fact, this Saturday I saw Peninsula Health was at the farmers market here in Shelton with a vaccine clinic right in the middle of the farmers market. Walmart, it's all over the place. So it's your choice. If you decide you're going to do it, please don't use that it's hard to get as a reason not to, because it's pretty darn easy now.
It's a demand problem, not a supply problem at this point.